organic versus psychological. And then I need you to be able to tell me about, again, the problems with like sildenafil, what not to take, how to take it. So know your sildenafil. The medication that I asked you about, I pointed it out to you, tamsulosin, finasteride, PDE5s, and I told you it's limited to the information within your Med-Surg book. Now, is that how proctors work? No, okay? So make sure that you are savvy to the medications because Med-Surg will put it all together. Yes? Now, to make it easy for you here in class, the medications, I tell them to you, and it's limited to the information within your Med-Surg book. Yes? Okay. The last two things is, if you scroll back to page, for female, okay, you will see cystostomy. Look at page 452. And 453. This is what we missed for female. There is two disorders, cystostomy and rectostomy. Now, I'm gonna pull up the picture because it's easier. While you go to the page, I'll pull up the picture to give a better visual of how these work. For now, this is easier to do. Okay. So, cystostomy and rectostomy. Let's see real quick what it is, okay? So, if you notice, cystostomy and rectostomy, we won't really focus as much on uterine prolapse. I'll go over that last. These, look at what it says. Protrusion of the bladder through the vaginal wall for cystostomy. Rectostomy is protrusion of the rectum through the vaginal wall. So, we're looking at this picture. Okay, here's the vagina, right? And do you see the bladder? How they share walls with the rectum through it, right? This here is your cervix. This is the opening, right? This is the cervix. So at the upper portion of the vagina, the rectum and the bladder, how it sits anatomically, they, right, that there's like a, obviously a wall there, there's tissue, but they share the wall. Make sense? So what this is, a cystostomy is when the bladder starts protruding, meaning pushing down into the vagina through that wall. So it's not that there's a hole and now it's going in, but imagine like this wall here and these muscles are so weak that the bladder is like sagging into the vagina, and the vagina wall is so like weak that it just like allows it to. It sags in. So you would have like a push against the vaginal wall. Now in the rectal or a rectostomy, the rectum pushes or leans into the vagina, and so it starts to come through. You'll see like a bulge. If you were to look into the vagina through a cystoscope, you would see that these pushes, these bulges of them coming in or pushing towards. Does that make sense?
Yeah.
Like the protrusion. Cystostomy is from the bladder, rectostomy is from the rectum. Yes? Yes.
They have both.
They can. Okay? Uterine prolapse, the other one, it's exactly what it sounds like. The uterus is prolapsing. It's coming down through. Okay? When it's severe enough, it's not only a bulge, it can actually come fully. Like this is basically like the vagina and the uterus is like rolling out from the vaginal opening.
Yeah.
Okay? I've seen only one patient that had it like completely like, you can actually see it outward. Now she was an older patient, so you can fix this with surgery. You can originally start with medication since the beginning. But with her being so much older, there wasn't a lot to like do surgically. They've just managed it medically, okay? So do we understand the visual? Okay, so I need you to know one thing for both, expected findings. So what will you see, right? For cystoscopy, urinary frequency, history of UTIs, rectoscopy, constipation, sensation of a mass in the vagina, fecal incontinence, hemorrhoids. It misses out on there, but they might feel like they don't completely evacuate the colon. Like after they poop, they don't feel like they completely evacuate it. Or there may be the need to put fingers into the vagina and push against the rectal wall to fully evacuate the feces, okay? Diagnostic procedures, again, a rectal examination, ultrasounds. The other thing that I need you to know is, I want you to see on the right side on page 453, the therapeutic management. And look at this, the pelvic floor muscle exercises, also known as Kegels. I need you to know how to properly perform Kegels. It's a question that comes up. Like, what should they do, or how should they do it, or how to instruct them? And here it is. Contract the circumvaginal and perirectal muscles. You tighten your pelvic muscles. Gradually increase the contraction period to 10 seconds. That's how much you have to contract for. Follow each contraction by a relaxation, so they slowly let go and relax over 10 seconds. Okay? Perform exercise 30 to 80 times a daily while lying down, sitting, or standing. They might also say that perform it 10 times, like 3 to 10 times a day. Does that make sense? So they do 10 contractions and relaxations 10 times, and they repeat those 10 3 to 10 times throughout the day. They're not gonna sit there and do 80 contractions for, right, who knows how long. You can do 10, and then an hour later, another 10. Another hour, another 10. And another hour, another 10. You can do this sitting up. You can do this sitting down. You can do this lying down. I'm doing it right now.
Oh.
So, if you want to tell your patient in real life how to do them, jokes aside, right? A good way, because they might be like, how do I, like, right? Almost think about it like when you're trying to hold yourself from not peeing, right? Tell them the way that they can focus on how to perform those muscles. Have them pee. Be like, when you pee, I want you to stop the stream. I want you to stop peeing mid-pee. And they're gonna do, right, that contraction, that. Tell them, I want you to do that without peeing. You gotta like contract and hold it for 10 seconds, relax 10 seconds. Squeeze for 10 seconds, relax for 10 seconds. You do this 10 times on the hour. This will help strengthen these pelvic muscles here, okay? This is useful for many things in life. One, so that you don't pee yourself when you're old, okay? Two, if you want to prevent like things like constipation, okay, like helps with aiding in birth. So if you're preparing, or if you're pregnant, you should be doing things like this. It has a lot of benefits for it, huh? Because sometimes you're unable to push out. It's not even that it's not flowing. As you get older, you may not be able to like have that contraction at the end. Okay, pre-ejaculation, all of it like that. All of this is helped by control of your pelvic floor muscles. Huh? Yes. It helps both genders. It's a misconception that it's for women. Okay. Now, real quick, because we're almost out of time. So, you need to know how to do this. Okay, the instructions will be like verbatim to how to perform Kegels, how many times a day, how to perform them. And I need you to know the expected findings. And lastly, risk factors. It's the second thing right there. I'd like to know things like, right, like obesity, aging, multiparity, having many childbirths, right? Constipation is another one that I commonly see. So know your expected findings. Your risk factors, expected findings, how to do Kegels. Okay? Lastly, you should know what a pessary is. And there's a picture in your book. A pessary, because the vaginal wall is unable to hold itself, a pessary is a little device like this. Okay? You see it has like a disc like this. Now, this device, as it's inserted, that circle, right, that frame at the bottom is doing what? It's holding the vaginal walls open, like a wedge. Yes? They need to remove this, clean it, and reinsert it. That's what we're gonna teach them. It is routine checks. It doesn't say how often, so don't worry about it. Okay? It's usually out of 7. Are we good? Rectosity, systosity, BPH, erectile dysfunction, PSA, EPCA, and digital rectal exam. Yes? Okay, so your test will be on all of this today, and the diagnostics and STIs and what we went over for female last week. Good? That'll be Repro, and we'll start neuro next week.